Eczema? It's one of those things that can make any parent feel helpless. Watching your newborn or toddler struggle with itchy, irritated skin is no fun. You've probably asked yourself, what can I do to help? Don't worry, you're not alone. There are simple, effective ways to manage eczema in babies and reduce those uncomfortable flare-ups. Bathing and moisturizing. Let's start with something you probably already do: bathing. But the way you bathe your little one could make all the difference in eczema management. First off, keep it short. Lukewarm water is best. Hot water can irritate the skin even more. Aim for a bath every day or every other day, depending on your child's needs. Now, when it comes to soap, it's essential to use something gentle, nothing harsh, nothing with fragrances. Opt for a non-soap cleanser made for sensitive skin, something like a mild baby wash, or something specifically labeled as hypoallergenic. You're looking for something that won't strip your baby's skin of its natural oils. Once the bath is over, gently pat the skin dry with a soft towel. Don't rub. Rubbing can irritate, and eczema-prone skin is already fragile enough. While the skin is still damp, apply a fragrance-free cream or ointment. Extra virgin coconut oil is a great natural option. Not only is it hydrating, but it's also anti-inflammatory, which is a bonus for eczema flare-ups. And here's a golden rule: moisturize, moisturize, moisturize. Twice a day or even more if needed, especially after diaper changes. Don't let the skin get dry. Dry skin triggers eczema flare-ups faster than you can say itchy. Avoid irritants. We all know the feeling when something just doesn't sit right on our skin. For babies with eczema, certain fabrics and harsh soaps can cause major irritation. So, what can you do? For starters, skip anything scratchy. Avoid wool, polyester, or anything that feels rough against your baby's skin. Stick to soft, breathable fabrics, especially 100% cotton. Harsh soaps are another big culprit. Even something that seems mild might contain ingredients that irritate delicate skin. Always go for something hypoallergenic, free from fragrances and dyes. It's also a good idea to keep your child's nails short. That might sound simple, but it's essential. When the itch starts, babies can't help but scratch. Short nails reduce the risk of breaking the skin and causing infections. If they can't reach their skin, they're less likely to make things worse. And during nap time or at night, consider using cotton mittens to prevent scratching while they sleep. Environmental factors. The environment your baby is in plays a big role in managing eczema. Keep the room at a comfortable temperature, not too hot or too cold. Humidity matters. Too dry air can make eczema worse. If you're in a dry climate or it's winter, consider using a humidifier to keep the air moist and help prevent skin from drying out. Diet and allergies. Eczema flare-ups can sometimes be linked to food allergies, especially common ones like dairy, eggs, and nuts. If you suspect a food trigger, talk to your pediatrician or a dermatologist. They can help you identify what might be causing the flare-ups and suggest an allergy-friendly diet for your baby. Medications. When eczema flares up, sometimes creams or ointments are needed to calm the skin. Talk to your doctor about topical corticosteroids or other medicated options. There are also over-the-counter creams that can help with itching. Whatever you use, make sure to follow your doctor's recommendations, as consistency is important for managing eczema effectively. Clothing and detergents. Clothing plays a bigger role in eczema management than you might think. Stick to soft fabrics like cotton. And when washing your baby's clothes, always use hypoallergenic detergents, no harsh chemicals or fragrance. Products like Dreft or Tide Free and Gentle are good choices for babies with sensitive skin. Monitor and prevent infections. One of the biggest concerns with eczema is infection. If your baby's skin is scratched open, it's more vulnerable to infection.